Hello, good morning, good afternoon, or good evening, wherever or whenever you're looking at this. We're back. We're Breaking Barriers Talks 2. It's only taken us about 7 weeks, but we've entered 2021 at pace. Only this time, I'm joined with a close colleague of mine, Rahim Daya, we have today to talk about the launch of this white paper that the Department for Health and Social Care has issued this week. Rahim, do you just want to introduce yourself a little bit?
Hi there. I'm Rahim, Senior Program Manager at Breaking Barriers, and I've been working on our playbook programs in Cornwall, Portsmouth, and Somerset, and hopefully going to give a bit of insight today into the new white paper.
Yeah, that's right. This new white paper, right, and it sort of seems to me, looking on, that it's almost in the DNA of the NHS to want to publish something new, to want to try something new every single year. Could you give us a bit of a summary about what the last 5 years have looked like?
Yeah, sure. So I think the biggest change that we've seen in the last 5 years is the introduction of sustainability and transformation partnerships, or STPs, which are now set to be superseded by integrated care systems. But I think what the introduction of STPs did was to promote integrated long-term planning and provision of healthcare by NHS and local authorities in a given 44 areas covering the whole of England, and that was really the first time that had happened. And the idea was that this long-term planning by senior health and care leaders would put community needs at the front and center of service delivery. And we're now expected to see integrated care systems become statutory bodies, which hopefully will mean even closer collaboration between NHS and local government in improving the health of the populations that they serve. And I think another big change that we've seen in the last 5 years is the setting out of the vision in the NHS long-term plan, which provides a 10-year ambition of how the NHS needs to change and adapt to continue to deliver services in the midst of advances in medicine, with changing health needs and developments across wider society. So I think those are some of the major changes that we've seen.
Yeah, absolutely. I'm hearing a lot of things there. One of them is community needs, placing their needs at the forefront of reform. The second thing is integration. And I've noticed that integration is this sort of central word that I see popping up all over the place. What does it mean?
So integration, I think it means that we want to make services talk to one another. So right now we have health and social care, and sometimes people aren't able to tell the difference or aren't sure what the other means. And right now the NHS is responsible for healthcare delivery, and local government is responsible for social care delivery, and sometimes there are barriers between how we can improve outcomes across both. And I think with this white paper, the key element of integration that the proposed changes focus upon is to make integrated care systems statutory bodies. And this hopefully will give them stronger and more streamlined decision-making authority, and embed accountability for health and social care within these bodies. So just to give a brief overview of what the structure of these ICSs might look like, the white paper proposes that they're made up of 2 bodies, each integrated care system. So the first would be an ICS NHS body that would be responsible for the day-to-day running of the ICS, so developing a plan to meet health needs of the population, and securing the provision of health services. And then there's a second body that would be the ICS Health and Care Partnership. And so that would bring together NHS, local government and partners, as well as the aforementioned ICS NHS body. And the aim of this health and care partnership would be to develop a longer term plan to address health, public health, and social care needs of a population. I think we've seen some of the benefits of integration and joined up care during the COVID-19 pandemic, because there's been a removal of some bureaucratic barriers. We've seen joined up care between GPs, home care, care homes, community health services. And I think there are populations that have definitely felt the benefits of that. And the hope is that this will continue with integrated care systems going forward.
And you've spoken an awful lot there about sort of system changes, right? But people and how they respond to these changes are really important. I've recently had a conversation with somebody who works in public health, and they said the biggest challenge for them at the moment is misinformation and how people are responding to misinformation. And that resonated with me because you and I have worked on things where trust is absolutely essential. How important is it for the NHS that they increased confidence and trust amongst those people who use the services?
Yeah, it's vital. It's crucial in order to have communities actively utilize these services with a great deal of confidence. And there's actually been accounts and data to support the notion that areas where COVID-19 has hit hardest in England are actually areas where confidence in the NHS and local government is low. So Bradford being one area where trust levels are low, and it's an area that's been hit particularly badly by the pandemic. And so the white paper acknowledges the importance of improving public confidence and aims to do this through one of the ways it aims to do this is through the merging of NHS England and NHS Improvement into a single organisation, but also granting the Secretary of State and ministers powers over the relevant functions of NHS England and also around local service reconfiguration. And hopefully that will make ministers and the Secretary of State for Health and Social Care more accountable to the public for the actions taken by NHS England.
Yeah, definitely. Accountability, you've mentioned there. I see that coming a lot in NHS reform. Integration as well. You've just said it again. You've integrated the word integration, funnily enough. That correlation between trust and how bad a location has been hit by COVID is fascinating, and I think that's an area that we need to keep our eyes peeled for. It sounds like there's an awful lot on the plate of NHS and health and social care reformers. Are they doing anything else?
Yeah, so there's a couple of other elements that the white paper includes that I want to bring up. So one around collaborative commissioning. So hopefully that will mean collaborative commissioning both between ICSs, so more than one ICS commissioning services, but also between health and social care. And I think that will remove some of the bureaucracy that systems currently face. Also, there are efforts being made to improve data sharing between health and social care organizations, which has obviously been very important for COVID-19 response. There's been some disappointment around the white paper not going far enough in addressing social care, though we should say that the white paper has been welcomed by the president of ADAS and CEO of Skills for Care. There is a proposal for the Secretary of State to have the ability to make emergency payments directly to all social care providers. So hopefully that will prevent instability in care for the most vulnerable people in our communities, particularly at a time when there's renewed pressure on the care industry with COVID-19.
Yeah, absolutely. And what I'm hearing from all that is just the sheer complexity of everything that's going on. A lot of people listening or watching will understand a lot of what you said, but I'm thinking, does a layman really get what this is about. Huge system change. What does it mean? And that is my question. What does this mean in real life for people?
Yeah, I'm sure there are some people who've never heard of integrated care systems or SCPs or anything like that.
Sure. What a world we live in.
So I think maybe we can boil it down to three things that hopefully these proposed changes will achieve. The first being the strengthening of patient-centered approaches through the integrated care systems, which will provide greater choice and control to patients by hopefully transforming services to be around population needs. And with the ultimate aim of reducing health inequalities. The second thing is around the removal of bureaucracy that may be posing a barrier to or delaying the delivery of effective care. And the third point is around increasing ministers' accountability for the actions and services of NHS, so that they're accountable to the public and any public concerns about NHS service delivery.
I think that's a brilliant place to end. What I've got there is greater choice, removal of bureaucracy, and better accountability. They sound good to me. Yeah, no, and hopefully they come to pass. Well, yeah, that's it, right? We can talk about it and they can write about it, but it's about how it's impacted on the ground, I'm sure. Rahim, thanks so much for joining us. And a special thank you for putting on a shirt and tie. You are smart in both senses of the word. It was great to chat, take a little canter down the road of NHS reform. Thank you very, very much. Thank you for having me.